Professor GOMEL, you moved from Istanbul after your graduation from Istanbul University, Faculty of Medicine, to Vancouver, and you achieved a lot. You got lots of prestigious awards, including Légion d'honneur. How do you feel coming back to the city where it all started and getting this very prestigious award in Istanbul?
Firstly, I am very honored to receive an award from the largest reproductive society in the world. Istanbul had taught me a lot. I had wonderful teachers who not only taught me medicine, but they taught me a way of clear thinking. I am very grateful for it.
You have introduced the microsurgery in gynecology. How did it happen?
As a resident, I saw a lot of patients being operated for occluded fallopian tubes in which they use prostheses and so on. And to remove these prostheses at second-look laparotomies, I saw that the abdomen was full of adhesions and it took a long time to even get to the prosthesis. Professor Svolin in Sweden had started doing it with loops, and so I went to see him. And eventually, I expanded the techniques to be able to do anastomosis, tubocorneal anastomosis, and so on. And then I started teaching them.
How did you decide to use the microsurgical principles in laparoscopy?
Laparoscopy at the time was a tremendous diagnostic tool, but it became evident to me that laparoscope could be used as a surgical access route. And in 1972, one night, when we were using the laparoscope to diagnose a tubal pregnancy, because we didn't have the techniques to do it as we do today without the need to laparoscopy. So we did that, and I thought I could remove the segment of tube that contained the ectopic laparoscopically. The next day, my head of department came to me and told me that he knew what I had done the night before. So I thought he was going to compliment me. He told me, "Victor, I know what you have done last night. You're going to kill a woman in this department. You do another one, I'll have to fire you."
What made you move to the IVF?
I had the good fortune to meet Professor Bob Edwards at a congress in Athens, Hilton, where he presented a paper on growing an in vitro fertilized human oocyte to the stage of a blastocyst. As you know, the oocytes at the time were obtained by laparoscopy, so that aspect we could have done. So he kindly told me to send him a technician that she would be well enough trained in 4 months for us to start a culture lab. I went back to my department head, and when I explained to him the whole process, he looked at me as though I had 2 heads. So it froze there. When I was asked to become head of department some years later, I couldn't start IVF immediately. There were urgent things to do. I started it 2 years later. Yet, good fortune permitted us to have the first Canadian-born IVF baby.
What made you the most proud in your professional life?
The ability I have had to transmit knowledge to my students, to my fellows, the ability I have had to teach techniques across the province in British Columbia, and the opportunity I was given by invitations to go to many other countries, even when I was quite young, to teach microsurgery, laparoscopic surgery, etc.
The last question is, what's your message to the young students?
I say to my students, be inquisitive, be curious, be rigorous, Don't take no for an answer. A no that doesn't have a rational or scientific basis. I also tell them, add some poetry to your life, as André Gide had said it so well.